You're pregnant, you go for your first scan, and they just casually drop that you've got fibroids. And you're thinking, fibroids? I didn't know I had those. What does that mean? What's it going to do for the pregnancy? Am I going to have a cesarean section? Will this end in a miscarriage? What's going to happen? And no one really has the answers, right? Because they don't know. You might get a few extra scans, you might see an obstetrician, but you probably are going away with this feeling that, everything has now become even more complicated. So in today's video, I want to talk to you about fibroids in pregnancy and what that can mean for the postpartum period. I'm Remi, a doctor in obstetrics and gynecology, a mother of two, and I'm building Her Health Room to provide education and empowerment to help you heal postnatally, physically, mentally, and socially, all while optimizing for lifelong health. If you're interested, subscribe down below. Why don't you comment, especially on this topic or anything else you'd like to see, because I really want to be building this platform with you in mind. So let's take the story of Jane. She's a 31-year-old. She's got a Nigerian heritage and she's pregnant with her first baby, and she's gone to have a scan. And at the first appointment, they say, you've got a fibroid. And she's like, what? Where is it? Oh, it's just at the top of the uterus. I don't think it's going to be a problem. It's only 5 centimeters. And then that's it. She discusses it with her midwife. Her midwife casually says, nothing to do about it. We'll see how it progresses over the pregnancy. By the time she's 36 weeks pregnant, she now has 2 fibroids. The one that was 5 centimeters is now 9 centimeters. It's at the front of the uterus, but luckily the baby's head is below it. And then she has another smaller fibroid, kind of near the cervix, but they don't think it's going to interfere with labor. She then goes into labor, but it's not really working and ends up with a cesarean section. And luckily she doesn't lose too much blood at the time of delivery, but they say to her, off you go, that's it, done. She has a 6-week check with the GP. Does the fibroid get mentioned? Maybe. But what is she supposed to do now? In this video, I want to break down what fibroids in pregnancy means, what it can cause, what it can mean for the delivery, and how you can manage the fibroids in the postpartum period with your clinician. So what exactly are fibroids? Fibroids are non-cancerous growths that occur in the womb. If you think of the womb like an avocado, you've got the skin, the bit that we eat, let's call that the muscle, and where the seed lives is the inside lining of the womb. So you could have a fibroid in any of those 3 layers. And if it's within the lining of the womb, it's felt that those fibroids can affect how a pregnancy implants. If it's within the muscle or on the outside, it will have mass effect when the pregnancy itself is growing. In pregnancy, fibroids can grow because there's an increased blood supply to the uterus, and sometimes they can even outgrow their own blood supply and start to die off, and that can present with really severe pain. Because of where the fibroids may be, it might affect how the baby moves inside. So babies typically need to turn head down by the 3rd trimester in order to have a safe vaginal delivery. And having fibroids can affect that process. So therefore, there's more likely to have a baby that's not in the right position for a vaginal delivery. Now again, if you think about the womb like a balloon and the head is at the bottom, there are cases where you'll get fibroids near the lower part of the womb, which affect how the head's going to come out, and therefore a vaginal delivery isn't suitable. If the fibroid is felt to be away from the lower segment of the womb, then it shouldn't interfere with delivery. So say you've gotten to the point that you've delivered the baby and the fibroids are still there. Because the womb is now bigger than what we would expect, and at that time, the womb is getting about 700 milliliters of blood per minute, the womb needs to clamp down and contract quite quickly to ensure that you're not losing too much blood. Now, if you have fibroids that distort the shape of the uterus, that process can be affected, and therefore there's an increased amount of blood that's lost. Now, fibroids can happen in all women, and the recent quotes are that 80% will be Black women and 70% will be non-Black women. And I think when we quote stats, it's really important to emphasize that fibroids can definitely be seen in all women. It is not a stigma for Black women. It's just unfortunate that Black women have higher morbidity, so they have more complications as a result of fibroids than their non-Black counterparts. And I say this and I emphasize this because I will never forget the day that I was seeing a patient. She came in for bleeding in pregnancy, say, and it was completely unrelated to the fibroid. And she came in, she was not Black, and she had a Black partner. And we were in the emergency department. And I said to her, any gynecological problems? And she looked at me and whispered, I have fibroids. I have fibroids is what she said. But I thought that only happened to Black women. And I took a breath and I said, no, fibroids affect all women. So the danger sometimes of emphasizing the importance of fibroids in all women, but emphasizing it for Black women because the morbidity is higher, is then it then becomes a stigma for Black women. No, not on my watch. So I very quickly educated her that it affects all women. There is no stigma associated with fibroids. And I'm hoping with all this research, all this awareness, that we're getting better treatment options. Where was I? I think I was talking about delivery, right? So say you have a fibroid, like I said, at the base of the uterus, there's an increased risk of needing to have cesarean sections in order for a delivery to happen safely. There is also a slightly increased risk of the placenta not really coming away at the time of delivery. Now, that's a lot to digest. But it's really important that fibroids, whilst a lot of them will be harmless, I had, I think, a 3 centimeter fibroid at my first pregnancy. It was seen in early pregnancy. I went on to have a few other scans because she was measuring too big. And after that, I'd never heard of it again. I've had scans since then, and it seems that the fibroid itself has disappeared. And that is a possibility. So now you survived pregnancy, you've gone through the delivery, maybe you had a massive blood loss, maybe you did not. You're now in the postpartum phase. What do you now do? How do you prepare for that next pregnancy or that potentially next delivery? So if you were to think that, oh, this fibroid only grew because I was pregnant, it would not be unreasonable to think that it might shrink after the pregnancy. But let's not assume, let's make sure we know for sure. So it's really important once you've gone through your 6-week check that you're discussing with your GP early on, early doors, to make sure that you have the plan to see a gynecologist at some point, where they would scan the womb to assess for the fibroids, to see if there's any change and to see if any treatment is needed. Say you were someone who had heavy bleeding before your pregnancy and you just managed or got on with it, which a lot of women do. Now you have an answer. You now know that that heavy bleeding is most likely to be as a result of the fibroids. So now what do you do? Now what you want to do is manage the heavy bleeding, because heavy bleeding can be treated in a lot of cases and therefore reduce the complications of low iron in the blood, which causes fatigue, headaches, brain fog, things like that, especially when you're in that recovery period. And say the fibroid grew so much to the effect that now it's affecting how you pass urine, it's affecting how you open your bowels, you have an ongoing bloat in the abdomen, it's affecting your mobility and your exercise. These are things that you definitely want to be discussing with your gynecologist to see what your treatment options are. So largely for fibroids, you want to treat the symptoms. Like I said, if you've got heavy bleeding, they can often be treated with some non-hormonal medication, hormonal medication. We can also do some procedures as well to help shrink the fibroids. There's a new one that uses ultrasound, or there might be some surgical options to remove the fibroids itself. So these are largely the treatment options that are available at the moment, but it's really important that you engage with care to see which one you could use. Because what you don't want to do is necessarily go on to have another pregnancy without dealing with the fibroids or without actually understanding what it means for your health, to then go on and have another pregnancy and potentially put yourself at risk of a massive blood loss at that delivery. And having said all that, they don't necessarily always need to be treated. If you find that you can manage the symptoms, you can manage the bleeding, you can manage the pressure symptoms, then you just keep an eye on them. You get regular scans, you engage with a gynecologist, you keep an eye on them, and then you go about your business, right? You go on to have your pregnancy. So where it would be higher risk, at least you are aware. At least you can have an informed conversation with the clinicians looking after you. Fibroids have been in the press recently because celebrities like Lupita and Nyong'o, Venus Williams, are discussing fibroids and how it's affected their lives. And it's great that we're getting so much more awareness for it, because what awareness does, awareness leads to research. Research leads to new treatment. And I cannot wait for a day that I can speak to a woman with fibroids and give her more than just the treatment options that we have available today. So what does this mean for you? If you have gone through pregnancy with a fibroid just newly detected, in the postpartum period, don't forget it. Don't ignore it. Don't just assume it will go away. Engage with a clinician, get it checked out. See if you require treatment and what those treatment options are. And then you can make an informed decision about what you want to do with your care. I have a quiz below. where I want to know how you are recovering postpartum, be that physically, mentally, and socially, because I really want to create products with you in mind. Now, thank you for coming to the end of this video. I think that you would really benefit from watching a video on postpartum hemorrhage, which is a massive bleed after delivery, because especially if you're someone that's been affected with fibroids, this may also be really relevant for you too. Until next time.